Now, last month we talked about the causes of sagging skin. In today's Health and Beauty Breakdowns, we were talking about treatments for those mild cases. Dr. Ronald Downs joins us now from Center PC, and in HD, picks up all the wrinkles and sagging skin. So I'm going to sit here and try to seem
well, don't make too many hand gestures.
Okay. It'll confuse the people on the treadmills, right?
We did talk about the causes of sagging skin: gravity, weight loss, medical conditions, and those types of things. And they do fall into two categories, mild and severe. So today we're going to talk a little bit about how to take care of the mild, saggy skin that can occur. And there's a number of different things that we can do. First and foremost, we hear about exercise. Well, if I tone my muscles, is that going to help my sagging skin? And to some extent it will. It'll help areas like your arms, your abdomen, your tummy. And why does that occur? The skin isn't a muscle. You shouldn't be able to tone the skin by exercising. But there are little connections between the skin and the muscle. So if you tone those muscles, it will really help in terms of getting rid of little mild sagginess in that skin. Now, the area that you have to watch out for is the neck and the facial area. You see a lot of things on TV. If you put these funny little spring-loaded things in your mouth and you make funny faces, and it's the instant facelift. Please be aware of those types of things. That in the facial musculature, that kind of thing really doesn't work that well.
I just talk a lot.
Yeah, well, that helps. Dermal fillers. Dermal fillers are something we've spoken about before. There are a number of different dermal fillers that are available out on the market today. Now, you have to be careful. There's two caveats to watch out for. One is you want to make sure that the dermal filler that you're going to use is approved by the Food and Drug Administration. These are little fillers that we inject under wrinkles or under deeper furrows in our skin to help plump those up and look less saggy, less tired. There's a number of different ones we can use. Restylane, Juvederm are some brand names you've heard. They're very commonly known among people. We use fat injections, people's own fat. They're very, very good. Now,
is that what this woman had done in this picture?
This would be a hyaluronic acid Restylane injection and the most common places are the nasolabial folds, little lines between the nose and the mouth, and also the marionette lines, those little lines that come down your chin from the corners of your mouth. That's what we call them. And it works nicely, and it works instantly.
Okay.
You get immediate results.
Is there some swelling, though, immediately, though?
A little bit of swelling. There can be some bruising, but literally no social downtime. Now, the thing you want to make sure you don't get confused is the difference between Botox and a filler material. Many patients come into our office and they want filler material and they ask for Botox. Botox is not a filler material. It is a paralytic agent, which means it paralyzes little muscles that will cause the wrinkles. Filler materials are actually stuff that goes in, they stay in the subdermal or the area just underneath the skin, and they can last anywhere from about 6 months to a year. Laser skin tightening. Now, I know we spoke about this before and when we talked about little wrinkles, but lasers are very, very good at some skin tightening as well. Uses an infrared light. It heats up the collagen in the dermis of our skin. Now, the collagen is what gives us that elasticity, that spring. And the heat will not only shorten the collagen bundles, but also stimulate new collagen formation. So that works very well. Again, a nice treatment usually takes more than one session, maybe 2 sessions, 1 or 2 months apart. Very, very little social downtime. Very, very good for minor sagging and wrinkles. And then, of course, I want to talk a little bit about laser liposuction. Now, liposuction is something we're all kind of aware of. It gets rid of little pockets of fat here and there. But with the laser liposuction, which is a new technology, we can actually take that laser energy up and with a real small cannula or introduction needle and get it right up underneath the skin, and that again imparts energy into those collagen bundles, and we can actually heat them up and stimulate them from inside the skin. So it really has two functions. It works beautifully for these mild cases of sagging skin.
All right.
So if those things aren't enough for you, if that doesn't do the trick, we have some real good tricks underneath in our armamentarium to help with the more severe sagging skin. We'll talk about those next time.
All right. Thanks a lot, Dr. Downs with our Health and Beauty Breakdowns. We'll be back with more right after this.